More than 40% of all pregnant women do not have access to skilled maternal health care at the time of delivery. Women who live in arid, semi-arid, rural, and urban informal settlements are less likely to enjoy the services of a midwife. These women are also less likely to receive prenatal and postpartum care. Kenya has a shortfall of about 20,000 midwives. In September 2015, Kenya joined the rest of the world in ushering in the Sustainable Development Goals, SDGs, at the 70th United Nations General Assembly in New York, USA. The SDGs replaced the Millennium Development Goals, MDGs, which expired in 2015. Unlike the MDGs, which were only 8, the SDGs are 17 expanded goals which address themselves several global concerns. One of these global concerns is maternal and newborn health, which falls under SDG Goal number 3 and is supported by Goal number 5. Kenya has ratified and adopted the SDGs and has formulated policy for implementation. The Reproductive and Maternal Health Services Unit at the Ministry of Health has contributed significantly to the strengthening of Kenya's maternal and neonatal health MNCH program. The National Maternal and Newborn MNH Health Roadmap was developed as part of efforts to achieve the MDGs and aimed to reduce maternal and newborn morbidity and mortality in Kenya through the building of strategic partnerships for increased investment in maternal and newborn health at institutional and program levels. It is guided by the Reproductive Health Policy. The government has also developed the National Guidelines for Quality Obstetrics and Perinatal Care in response to the need for holistic maternal care. Similarly, the standards for maternal care in Kenya were developed to address obstetric emergencies such as hemorrhage, sepsis, preeclampsia and eclampsia, obstructed labor, and unsafe abortions. The Beyond Zero campaign, spearheaded by First Lady Margaret Kenyatta, has mobilized resources and partnerships to improve maternal and newborn health. In addition, the campaign has seen the distribution of mobile clinics to all the counties to increase access to skilled care, especially within the hard-to-reach communities. Despite the existing favorable policy, the reality on the ground is stark. Close to 40% of women who attend prenatal clinics opt to give birth away from healthcare centers in spite of waived delivery fees. 38% of women in hard-to-reach parts of the country face the risk of death and pregnancy complications. 600,000 children are born without skilled medical assistance. The teething devolution challenges, especially in the health sector, have affected the quality of service delivery. Having inadequate midwives makes it a challenge to provide quality care to women in delivery. Concerns for personal safety for medical personnel in areas with insecurity leaves women in these areas with limited services. In Kenya, it is estimated that maternal mortality rate is 362 per 100,000 live births. This translates to more than 5,400 women dying from pregnancy and birth complications. Women in semi-arid areas and informal settlements are at a higher risk of maternal death. When mothers do not receive skilled birth attendants, their children also face high risks of disease and death. The burden of death and illness is borne not only by women and their children, but also by the families and communities that depend upon them. We call on health policy makers, medical practitioners, and other stakeholders to combine their efforts and work together to save the lives of women across the country. We call on the health policy makers to employ more skilled healthcare providers, and in particular midwives, to arrest the shortfall in skilled birth assistance. Key things: train, employ, deploy, and retain the midwives in service. We call for increased public-private partnerships and investment in maternal and neonatal care. Investing in midwifery will greatly reduce maternal deaths. To this end, more specialized midwife training facilities are therefore required to equip midwives to provide care during pregnancy, at birth, and during the postnatal period. We also call upon the Ministry of Health as the largest trainer and employer of midwives to support the training of midwives, direct training of midwives, as well as the specialization of nurse midwives. Allocate resources to train more midwives. Deploy them appropriately. Provide incentives to retain and motivate them. Improve infrastructure and provide equipment in the health facilities. Strengthen regulatory and policy framework for midwifery practice. Finally, we call for more targeted public education to dispel myths that surround hospital birth, to raise awareness on the benefits of assisted delivery and postpartum care, and to provide information on healthcare resources available to women at the point of delivery. Such public education should be aimed at midwives, women at the point of delivery, community leaders, and policymakers. Safe delivery is a right every woman should enjoy. Having well-trained and supported midwives will save over 3,500 lives annually in Kenya. Midwives are an integral part of skilled delivery care at all levels. Given the current maternal mortality ratio of 362 maternal deaths per 100,000 live births, having well-trained and supported midwives will save over 3,500 lives annually in Kenya. Skilled care during childbirth can lead to better health for both mother and newborn and prevent death and disability, which contributes to poverty reduction. The lives and health of thousands of women and children could be saved each year with more investments in midwifery training, employment, and retention. We need high-level political commitment at the national and county governments to address the shortage of skilled birth attendants. There is need to strengthen regulation and accreditation, proper employment protection, remuneration, incentives, and motivation for our midwives. To achieve Kenya's target in Sustainable Development Goal number 3 of reducing maternal mortality ratio to below 114, we must train and employ more than 20,000 midwives.